The world's hottest spy target right now is Fat Ass 45's health. Fat Ass 45's doctors won't say when he last tested negative for the COVID-19. They won't reveal any details of how his lungs are functioning and why he was prescribed advanced treatments usually reserved for severe COVID-19 cases. How high his fever soared, or just how low his oxygen levels had dipped. As the White House brushes aside questions about just how serious the fat ass is about what the lethal virus really got, America's enemies are poised to fill the information void. Former and current U.S. national security officials are warning. Their fear, foreign adversaries are working overtime to glean insight into the true state of Fat Ass 45's health and potentially use it as a leverage to make mischief and sow doubt about the stability of the U.S. government. For example, using doctored photos of audio of a pale or hoarse Fat Ass 45 to make him seem sicker than his team is letting on, and paint America as unable to handle the pandemic. Foreign intelligence agencies invest heavily in the ability to collect sensitive medical information about world leaders seeking to place sources where they would have direct or indirect access to these discussions, former and current officials have said. Any foreign intel service worth its salt is going to want to have assets onto the ground, spies and sources who can report on the fat ass's health, said Steve Hall, a former CIA station chief in Moscow. It's a key requirement that gets to what we really usually call plans and intentions of a foreign government. Now, I'm not sure if I'm going to say this last name right, but it will probably be fucked up anyway. I'll probably fuck it up. The guy's first name is Mark, but his last name is Polymeropoulos. I don't know if I'm saying that name right. A former CIA and senior intelligence officer who retired in 2019 said it would be part of a routine task given by foreign intelligence services to gather information during such a crisis like this, and that as an intelligence officer himself, such tasking on the U.S. side was normal in every country he served in. Um, it was often feasible to collect information on the health of our adversaries' leadership, as the targets for recruitment were not the other country's intelligence service or even government personnel, but rather hospital or administrative staff targets that would not have the counterintelligence antenna up. While Hall expressed skepticism that adversaries like Russia and China could have spies inside Walter Reed Medical Center where the fat ass was receiving treatment over the weekend, and into Monday he argued that it's more likely they would use established sources in the White House. Fat Ass 45 announced on Monday that he would be heading back to the White House at 6:30 p.m., just days after he first checked into the hospital. Press reports indicate Fat Ass 45 was on the phone with foreign leaders. If one of those calls was with Putin, and I was Putin's intel chief, I'd have a Russian duck in the line to listen in. Hall said. Was he short of breath? Did Fat Ass 45 seem confused? This information could easily be exploited by foreign adversaries, particularly in an environment where confusion about the fat ass's health is already rampant, said Mickey Mulroy, an ABC News analyst and retired CIA officer who served as a deputy in the Pentagon until last year. The misleading briefings from the White House medical team are creating a crisis of confidence in the chain of command. Mulray said, this could easily be exploited by foreign adversaries such as China, Russia, or Iran, launching disinformation campaigns designed to reduce the confidence of Americans in our government and the election process, he noted. Mulray called on Defense Secretary Mark Esper, who just returned from a week abroad, and other national security leaders to be present in Washington, D.C., to ensure the continuity of government and send a message to any adversary that may want to exploit the situation. Administration officials continue to insist that the situation is under control and that they are not unduly concerned by the potential for foreign adversaries to exploit this crisis. Our adversaries know that the United States government is steady at the tiller and that we're protecting the American people. National Security Advisor Robert O'Brien said on CBS on Sunday. Yeah, bullshit. Um, Still, concern over adversary exploitation is one reason releasing the medical information of U.S. leaders is typically handled so carefully. Most presidents, except for Fat Ass 45 for instance, have their doctors put out detailed letters about their vitals, any medications, and past or current illnesses. But although Fat Ass 45 is the oldest ever to be elected to a first term as squatter in 2016, he has refused to release any of his medical records. Instead, his former doctor put out a glowing statement in December of 2015 stating, if elected, Fat Ass 45, I can state quickly, will be the healthiest individual ever elected to um, will be the healthiest individual ever elected to the squatter. Later, the doctor revealed that he did not write that. Fat Ass 45 had dictated the letter himself. True to form, the White House's handling of the fat ass's COVID-19 diagnosis has added to a sense of confusion and chaos in the upper echelons of the U.S. government in recent days. Officials on Sunday acknowledged that Fat Ass 45 had experienced what they call concerning drops in his oxygen saturation level since his positive test, while also insisting that he could be discharged as early as Monday. Later, the Fat Ass himself made a surprise appearance in public, masked up and waving into crowds of his inbred welfare trailer park collecting supporters from inside the Squatterall limo before returning to Walter Reed Medical Center. Meanwhile, White House Press Secretary Kayleigh McEnany became the latest in string of staffers and senior GOP officials to fall victim to the COVID-19, announcing on Monday that she had tested positive for the virus. But the administration has continued to downplay the virus and the fat ass's illness, and argue that neither the national security apparatus nor the world needs to know Fat Ass 45's precise medical condition. Yes, we do. We need to know exactly how fucked up he is. I don't think we need a handle on the exact medical situation because we are not doctors. But it is clear that the Fat Ass is doing his job. Yeah, what job? He's not incapacitated, and the entire machinery of government is following under him. Yeah, following the basic line for him. Said Elliot Abrams, the State Department's special representative for Iran on CNN, said, noting that adversaries would be ill-advised to exploit the situation, but given the White House's obfuscation on the Fat Ass's coronavirus diagnosis, it would not be unreasonable to suggest that foreign governments like Russia and China with active and what they call elective collection programs would have better info on Fat Ass 45's medical condition than even the American public itself. Foreign intelligence shops would likely have sources with access to what White House insiders are hearing about the Fat Ass's treatment and intelligence about whether staffers are being sloppier than usual with communications security given the crisis, said former acting CIA Director John McLaughlin. Given that the fact that foreign intelligence services, particularly hostile ones, have no higher priority than understanding events in a Fat Ass's inner circle, it's reasonable to assume that they have sources somewhere seeking access to reliable information on his diagnosis, said McLaughlin, and it's hard to say whether this would amount to something more transparent than the American people is getting, but they were certainly trying to factor out the spin. As of Monday morning, the intelligence community had not yet provided the Congressional Intelligence Committees with information about foreign mischief of disinformation efforts surrounding Fat Ass 45's diagnosis, said one congressional source who cautioned that this should not be taken to mean that no such intelligence exists. But as of now, we can rightly assume that foreign services are actively collecting and likely successfully so and finding out more about the Fat Ass's health status than the U.S. media and the American people. So if you like the video, give the video a like and subscribe to my channel, Ryan Van Wyk, and also hit the notification bell so that you'll be notified when a new video comes out, and thanks for listening.